I'd like to thank the organizing committee for allowing me to share our healthcare innovations in Saudi Arabia with particular emphasis on King Faisal Specialist Hospital. Are my slides coming out? Okay. I think we face lots of challenges, not just in Saudi Arabia, but as worldwide. The advances in healthcare have created new challenges. The aging population is a community problem, which really leads to a lot of global problems. The families now are looking after the elders, and this leads to social consequences and ultimately the economic consequences. In the past, the lifespan was 10 years younger. Now, with the new epidemics occurring at a younger age, we are seeing more and more diseases. In most countries around the world, the lifespan is increasing. So together with the aging population and the change of lifestyle, this causes a greater burden. I'm hoping they'll put up the slides because they're really nice slides that we really worked hard on at that point. I think they were. So anyways, this has brought major diseases to the forefront with particular emphasis, and I'd like just to spend a minute or so on diabetes. In Saudi Arabia, 1/4 of the population above 50 are diabetics. The majority of the hospital beds are occupied with patients with diabetes, and the complications usually are the cardiac. There's a huge dependence on the diabetics on the renal dialysis, and cancer now is also on the rise, compounded by people living longer. The costs associated with maintaining these patients have the potential to bankrupt the economy. This is a major burden. The occurrence of hereditary diseases, and this is really where I come in because I tend to see these patients on a daily basis, and it's actually higher in the consanguineous populations, such as this region, where Saudi Arabia has by far the largest population. Hereditary diseases are a socioeconomic burden, and as I mentioned, we see this a lot, cousins marrying into cousins, and the customs really prevailing over the medicine. And the cost of the affected individuals further burdens the economy. So we really must address these challenges. I'm hoping they'll get these slides up. As I said, they're nice slides that I'd like to be able to share. The second thing we have is the innovation. Thank you. So we finished this slide, but I'll just go over just to show you what we had. Sustainability is dependent on innovation. Innovative research has a far-reaching effect on our lives. It has upgraded the standard of medical care, producing advanced methodology in medicine that allows us to prevent and cure. And today, we are building more hospitals. The answer is not in only more hospital beds, but early detection, screening and identifying, preventing and delaying onset. We have to prevent in order to delay the onset. Early detection leads to prevention. Therefore, prevention is the medicine of the future. The major impacts can be made in these areas really by curative procedures. The key word in innovation is personalized medicine. What do we mean by that? It's medicine customized to patients looking at detailed treatment. The tumor in each individual cell has its own fingerprint, and I'm really trying to talk in a very, very layman sense. Our technology today allows us to identify the fingerprint so that it fits like a customized glove rather than one size fits all. Personalized medicine in which treatment would be tailored to the individual's genetic makeup. There's also the smart therapy, and a good example is the Glivec for the chronic myeloid leukemia, where it targets specific cells rather than the body itself. So these great advances in patient treatment continues to be made. The King Faisal and other institutes are actively engaged in addressing these challenges. What are we doing to address these challenges? We have what we call the radiopharmaceuticals production. This initiative is very important in that it actually, this initiative supports the advanced accelerator technology, radiochemistry, radiopharmacy, radiopharmaceuticals, and it allows for expansion of the services, and it solidifies the kingdom's role as the primary and leading supplier for radiopharmaceuticals and other to the other region. Because we are in a desert, the half-life, shelf life, we cannot export these pharmaceuticals. So we have to be able to manufacture them and be able to distribute them to the other region. And this is actually a revenue generating of the research center at the King Faisal Specialist Hospital. The intensity modulated radiation therapy, this has expanded the King Faisal to treat the tumors. We have the health statistics and informatics. This is very important. We've gone digitalized and now we are becoming paperless. And it's very important that we have established a number of registries in collaboration with the King Abdulaziz City for Science and Technology and the Ministry of Health. The Center for Clinical Research, this is also a very important new generic medicine specific to our population, testing the bioequivalence, the cell biology. We do have to understand the mechanism. I'm just going through these just to outline what we are doing here in Saudi Arabia. The cell therapy is very important, and we are the largest institute in the world, secondary to the USA, when we focus on cancer stem cell therapy. The gene therapy, this is actually in my field, and we are at the moment actually trying to map the genes for the retinal degeneration. This is an example of a global impact of research in genetic ophthalmology. The human genome, I think most of us are very well with the human genome. The research center at the King Faisal Specialist Hospital pioneered the genome project in the Arab world. You have to remember, what applies in the West does not apply to us here in the Arab world. So we applied it to the inherited disorders in the Arab population, and more recently in diabetes, cardiac disease, and cancer. So mapping genes to tailor treatment to patients specific to the genetic makeup that we have here. These advanced programs have tremendously helped. Let us now focus on the challenges and innovations associated with prevention of disease. I'm not going to dwell on this, but this is what we call the circle of life. I've just picked up the hereditary diseases. What we would like to do is really where the lady and man are and be able to do the premarital screening. Unfortunately, the patients become pregnant, so we offer them the pre-implantation genetic diagnoses. Then they get pregnant, we offer them the prenatal testing, and if they are born, this is really the catastrophe. And we have been able to screen these inborn errors of metabolism, which we are screening 150,000 newborns per year, and we are hoping in the next 3 years to be able actually to screen all newborns in Saudi Arabia. And this is a very big task for the King Faisal. You have to remember, if we detect these patients early, the mortality and morbidity can be substantially reduced. The worst stage is the molecular diagnosis, and you don't want to have to reach that where patients already have the disease. So our key challenge really is to shift the emphasis from post-symptomatic diagnoses to preventive screening. The key word in innovation is prevention, and this is very important. So the huge investment in genetics research by the King Faisal Specialist Hospital and Saudi Arabia has been focused on the Arab population, and this has allowed the development of regional molecular genetics, and this is where our commercial arm comes in, and I think this is very important. A good example is the Saudi Diagnostic Limited Company. This is where we have actually translated and commercialized such research by the King Faisal Specialist Hospital and Research Center, and this has stimulated development of several new commercial projects, which together are really forming an important part in the beginnings of a national biotechnology sector and the delivery of better, improved healthcare. Long-standing dedication of the research center is to transfer related technology to the private sector. Therefore, we are creating new industry, new job opportunities, and we're helping to transform Saudi Arabia into a knowledge-based economy. My last slide. Saudi Arabia, through the KFSH RC mega project, which is really we are facing and addressing the international and national challenges with focus on application and innovation. It has embraced recent developments. One of the very important is the King Abdullah Oncology and Liver Transplant Center. This initiative will address the growing number of patients suffering from cancer and liver disease. And this is a mouthful, the proton carbon ion therapy facility. This advanced, innovative healthcare will bring the kingdom to the level of the 10 most advanced radiotherapy facilities in the world for treatment of cancer patients. Last but not least is the Saudi biotech complex. This initiative supports the National Comprehensive Plan for Science and Technology, providing specialized medical services in the area of biotechnology and manifests the research center commitment to translation research. However, even with these tremendous facilities being introduced here and around the world, investment in future healthcare must change its research emphasis from treatment, and again, to early pre-symptomatic disease diagnosis and prevention. And again, this is the buzzword, this is the keyword, is prevention, or at least the delay in disease onset. This is where the maximum future benefits will come from for national population and government healthcare budgets. Thank you once again.